Thank you very much, Helma. Good morning, everybody. Very excited to be here and to be able to welcome you on behalf of the National Institute of Environmental Health Sciences, and my director, Linda Birnbaum, who would love to be here as well, is very supportive of this issue. My name's John Balbus. I'm the Senior Advisor for Public Health at the National Institute of Environmental Health Sciences, and also a member of the Planning Committee, and helping NIEHS as liaison to this committee. This is the Committee on Emerging Science for Environmental Health Decisions, and this is our 15th of a series of very successful workshops. This one's real different. This has been a committee that's really been formed and has been focusing a lot on the basic sciences of environmental health and toxicology and biology. But this committee has for many years wanted to address this area of emerging science, and certainly the area of the health impacts of climate change is truly an emerging area. It's a new area. There's a lot of innovation and a lot of change going on in it. And I just want to start by thanking the committee for its vision in seeing that its scope and thinking about emerging science includes these very important issues that we're going to be talking about in the next couple of days, and that we are needing to make very good decisions about and need the best scientific evidence-based information to help us make those decisions. So my favorite climate scientist, Yogi Berra, once said, "You don't have to swing hard to hit a home run. If you got the timing, it'll go." And I thought that was a way to start off. The timing for this meeting is really quite extraordinary. It's been quite a time in climate change and health. Really a watershed moment. On the international front, there have been a lot of developments ranging from the very first World Health Organization Summit on climate change and health, which took place last August, leading up to the UN Climate Summit, which had the very first thematic session on climate change and health. And of course, right before the UN Climate Summit, the World Health Organization released a new global burden of disease assessment for climate change and health, which really represents some of the cutting-edge methodology and approaches to estimating health burdens of climate change. That just came out last month, and we're very pleased we'll have representation from that effort. Domestically, things are really moving along as well. We had the first ever briefing of the entire Department of Health and Human Services on climate change in August. We released the United States National Climate Assessment just last May. That had a health chapter, and I'll be going through some of the key messages of that health chapter. But importantly, that National Climate Assessment stopped short of doing any kind of quantitative assessment of the burden of health impacts in the United States. It was a very thorough review of the literature. It captured the breadth of health impacts, but it didn't do quantitative assessment. And right now, just a couple of, as we speak and as we meet here, there's a team of scientists working on a global change research program, Climate and Health Assessment, that is doing a more comprehensive review of the literature and is doing just what the last National Climate Assessment was not able to do, which is to provide some quantitative health burden assessment of climate change impacts in the United States. And we're very fortunate to have representatives from the teams working on that here as well, to be talking about the approaches and the state of the science there. So the timing is really perfect for this workshop. I'm extremely excited to see this all come together and to do what we need to do over the next couple of days. There are several goals that we have. One is to bring together these different teams who are doing these kinds of projects in different settings and really figure out where we are now to assess the state of the science. The second thing is to look at where we are now and to think about the questions that we really have to be answering, and ask the question, are the models, are the approaches that we have now able to answer all of the questions that we need to answer for the decisions that we need to make? Do we have the information we need to be putting in place interventions and adaptive measures to be able to protect health in a setting of a changing climate? Do we have all the information we need to make decisions about the degree of mitigation, et cetera? These are important decisions we all have to make. Health is a huge part of it, and we're just now getting to the point where we can provide some kind of quantitation for that. And then the third goal of this meeting will be, as we ask those questions, how do we move forward? What are the partnerships we need? What are the approaches that we want to take a look at? How do we get the right teams together to take us to that next level? So I just wanted to very briefly introduce some of the ideas, and for those who are not as familiar with this issue of climate change and health, to go through what are the range of health impacts that we are concerned about in a setting of a changing climate. And let's see. I'm not sure where I need to point. There we go. So I'll start off with this slide, which I'm very grateful to my colleague George Luber, who's here in the audience, for developing this and lending it to us. This is the latest. This is the cutting edge in terms of graphics on the health impacts of climate change. And so you can see in the center is representing the physical climate, and the revolving kaleidoscopic wheel in the middle is identifying some of the primary manifestations of a changing climate: higher CO2 levels, increasing warmer temperatures, rising sea levels, and increasing severity of certain kinds of extreme weather phenomena like hurricanes. The next circle shows some of the pathways by which those climate changes can impact health. And this ranges from everything from just higher temperatures around us to the impact of these climate drivers on more complex systems like the ecological causal chain that brings Lyme disease to humans by having the association of ticks and the bacteria in the ticks and the white and the mice and the deer all interacting to lead to ticks biting humans and causing that disease, to even more complex societal issues like what happens in the setting of a severe storm like Katrina or Superstorm Sandy, when the health systems go down and people in nursing homes and people who have chronic medical conditions need access to care and can't get it. So the impact of climate events, weather events on human systems and subsequent health impacts. All of that is in this diagram in one place or another. And so this raises a couple of issues for us in the setting of this workshop today. The first is that there's a lot of different things we're talking about when we talk about modeling the health impacts of climate change. And while we need to think in a holistic and integrated fashion about the total burden, being able to quantitatively assess them is going to require thinking about some of these impacts separately. It's going to be different to look at the impacts of air pollution, for example, from the impacts of nutritional stresses related to impacts on the agricultural system. A lot of different approaches need to be brought together and figured out in one place. And that's partly what we're going to be doing today. Let me go through some of the key messages from our National Climate Assessment. I think it resonates with this diagram a little bit. And then we'll be able to jump in and start looking at some of the specific efforts that are underway. So the first key message from the National Climate Assessment, again, this was a health chapter that came out last May, relates very directly to this diagram. And that key message is that climate change threatens human health and well-being in many different ways, many of which are represented here, some of which we can't even fit on the diagram. And that some of these health impacts are already occurring in the United States. This was a very important conclusion of the National Climate Assessment. We are able to observe changes in our environment that are attributable to climate change, changes in pollen season, changes in long-term temperature trends, and these kinds of changes that we've been able to detect, we know are having impacts on our health. The second key message is that climate change will, absent other changes, amplify some of the health threats the nation now faces, and that certain people and communities are especially vulnerable. And this is a second very key element as we think about modeling the health impacts of climate change. It says that it's not a one-size-fits-all. Different populations, different communities, different regions are going to experience the health impacts of climate change in different ways. And our models need to be able to not only identify who is most vulnerable so that we can target interventions and protect those most vulnerable people, but we have to be able to think decades into the future. And when we talk about climate change as an exacerbator of existing health problems, we have to be also able to say something, what's going to be the state of those health problems with or without climate change in the future? And that's one of the big challenges that we'll be talking about over the next couple of days. So in order to figure out who's vulnerable, we have to think about who's vulnerable now, and then what will that vulnerability look like over the time periods into the future that we're trying to assess the health impacts of climate change. The third key message is that public health actions, especially preparedness and prevention, can do much to protect people from some of the impacts of climate change. As threats increase, our ability to adapt to future changes may be limited. Again, the reason we're here is to be able to inform the kinds of decisions that we have to make, both in terms of limiting the extent of climate change, but also in terms of providing protection to the vulnerable people who are going to be experiencing the risks, regardless, at this point, of interventions that we make, we are committed to a certain degree of climate change. We have to be able to protect people from what we are already committed to, even as we try to prevent more severe climate change from occurring. And then the last is that responding to climate change provides opportunities to improve human health and well-being across many sectors, including energy, agriculture, and transportation. This is a key message on the positive side, saying that as we address climate change, especially from a mitigation standpoint, but also an adaptation standpoint, that there are opportunities for improving health. If we reduce fossil fuel combustion in coal-fired power plants, we know that we will save lives from the reduction in particulate matter air pollution. That's the clearest example. Some other types of co-benefits come from changes in transportation systems, potentially from other systems. That's the positive side. In a day and a half, we're not going to be able to get too much into the modeling side of that, but I think that key message resonates because it tells us we are operating in multiple sectors that impact health. And one of the themes of our modeling today will be, how do we look at changes that are occurring in transportation, changes that are occurring in energy production, changes that are occurring in agriculture and food production, food storage, food distribution? These are outside of the health sector, but if we're thinking about the health impacts of climate change in the future, we have to be able to think about the impacts on those other sectors and bring them back to the health outcomes. And that's one of the challenges we also are going to be facing. So let me close with just a final quote from my climate scientist, Yogi Berra, who said, "It's really tough to make predictions, especially when they're about the future." This is going to be one of the sub-themes of our meeting, is how do we look at the future, how do we get the right kind of data to be able to create the kinds of models, the kinds of predictive approaches that give us meaningful information to be able to make decisions. So with that, we can jump right into our agenda. And thank you for your attention this morning. Thank you for being here. And let's bring up our first moderator. Thank you very much. It isn't me. We actually don't have a moderator. Do we have a moderator for the first session? I don't think we do, because we don't really have a question and answer and a facilitated discussion for this. Bill was going to be the moderator. Okay. We did have a last-minute change. So with that, let me with great pleasure, introduce our first speaker, who's Dr. Jan Semenza of the European Center for Disease Control. And we've asked Dr. Semenza to come and open up our workshop to give us an overview of the current state-of-the-art of climate modeling from his perspective. So thank you very much, Dr. Semenza.